Good day, Professor. My name is Effie Sibiliano. Today, I will present the core value model I developed for your company, Practice Health Check. This final product is based on what we discussed in our meetings and reflects your feedback on my previous presentation and draft model. You mentioned that your company had grown exponentially during the COVID-19 pandemic, and it has been more focused on service delivery since its existence, leaving the improvement of the organizational system behind, including the lack of core values. As such, the lack of core values becomes visible in how employees interact with the company executives, with each other, and the clients. When the negative approach and working relationships continue, it will negatively impact your company's reputation and endanger its existence since your employees' actions reflect the company's values. From a client perspective, who would like to hire a consulting company that does not foster team unity and negative behaviors are visible? The core value model I will present is simple and easy to understand. It is customized based on the facts you shared with me, my research, and my relevant experience. It is also easy to apply and implement in your organization. So basically, the model has three core values. The first one is do what is right. It is about integrity, trustworthiness, and accountability. The second one is be excellent. It covers continuous learning and improvement, maintaining expertise, and ensuring up-to-date knowledge. The third core value is be open-minded. This includes curiosity, allowing mistakes, and practicing empathy. Now, I will define and provide three behavior indicators for each core value so that you will have a detailed basis for communicating and implementing them in the workplace. They can be a daily basis of practices in the company from executives to employees, as well as when dealing with outside stakeholders, especially your clients. Do what is right. The definition is to do what is right in all circumstances so patients and community members' interests are protected. And its behavior indicators include: we take responsibility for our actions by acknowledging and learning from our mistakes. You mentioned that making a mistake and learning from that mistake matters to you. The learning experience will become a strong reference or basis in the future. The second one is make decisions based on what is right no matter what. There will be times when conflicting interests arise and you have to decide which matters more between client and patient. In times like that, the decision making should be based on what the company believes to be right and the welfare of the patients, as you mentioned in our previous meeting. The third behavior indicator is demonstrate reliability and trustworthiness by aligning actions with words. When actions are aligned with words, there is no confusion. Being reliable and trustworthy will allow your clients to follow and implement your advice. Be excellent. Its definition is to strive to do better, using our expertise to create solid partnership with our clients and contribute to their success. And its behavior indicators include: first, we place self-learning and actualization to maintain expertise. This includes motivating employees to be fully committed to professional growth, be competent and experts, and maintain that expertise. The second one is support others to understand better and perform their work. This is about creating new experts as a result of sharing the knowledge and skills of those who already possess them. You mentioned that you want to hear your employees teaching each other and discussing how they help the clients. There are examples of helping each other through sharing knowledge and experience. The third behavior indicator is execute a quality service by having a solid grasp on client needs. This includes the reliability of the practice health check on the quality service it offers due to this expertise. So to summarize, being excellent includes being an expert, creating new experts, and sharing the expertise with clients. The third core value is be open-minded, and its definition is work as a team and keep an open mind to all new input and seek to understand first. And its behavior indicators include: first, we create the conditions that foster curiosity. This involves asking questions and creating an environment for problem solving. You mentioned that practice health check needs to make rash decisions and that autonomy matters for employees when it comes to prompt decisions that do not necessarily require higher management's opinion. This behavior indicator will promote them. The second one is welcome new ideas and embrace change. This includes accepting new ideas that have not been previously considered. When it comes to change, there are changes beyond control. So embracing and adapting to these changes is the best approach for an organization to survive. You mentioned that you see Practice Health Check as a solid organization that continues to grow. In that case, embracing change is essential. The third behavior indicator for being open-minded is listen with empathy and without judgment. This involves active listening and practicing emotional intelligence. Psychological safety should be placed in the workplace and avoid negative judgments. This will also promote good working relationships and avoid negative behaviors such as being aggressive. This core value model will guide employees in acceptable beliefs, actions, or practices. It will be easier for you as an executive to communicate the company's core values and have enough guidance in decision-making through this model. This will also be beneficial in shaping your company's culture. Thank you. Now is the time for questions if there are any.